Today we're going to talk about BPPV. BPPV stands for benign paroxysmal positional vertigo. Basically, it's a condition that disturbs somebody's balance. So it happens in the inner ear when the little calcium pebbles get thrown around and they get dislodged in the semicircular canals in the little part of the inner ear. They could disturb somebody's sense of balance. So a patient like that would present with various symptoms, the biggest ones being dizziness and vertigo, but they could feel unsteady or nauseous. And it predictably happens when somebody changes positions or moves their head. So if you have symptoms of dizziness or vertigo, it definitely warrants a trip to see a healthcare professional. Physiotherapists are one of the healthcare professionals who undergo special training to be able to assess and treat such symptoms. Simple procedures that we'll start with after the interview is a Dix-Hall Pike maneuver. I'm going to ask the patient to come and sit this way. After we go through all the careful screening, I'm going to explain that as she goes into this position, I'm going to disturb the little calcium crystals in the channel, in the inner ear, and it's going to provoke the dizziness and the vertigo, but it's not going to make the condition worse. And this is one of the assessment techniques that we will have to do to know for sure that somebody has this condition so we could treat it successfully. So just come and sit up here just a little bit longer. I'm going to get you to turn your head 45 degrees and you're going to be lying and your head will be backwards. We're going to go back on a count of 3. Hold on to my hand. So I'm going to hold sides of your head like this and hold on to me nice and tight, and we're going to go 1, 2, 3. And I'm staying with her. Even if she's feeling dizzy, she's completely safe and supported. I'm looking in her eyes to see if there's little nystagmus, which is the uncontrolled, quick, rapid movements of the eyes. And if the test is positive, or even if it is negative, there's other procedures that we will be going through to determine for sure if she suffers from BPPV. Just a word of caution, BPPV symptoms can mimic other conditions. For example, inner ear infections, Meniere's disease, or even neurological conditions. This is why it's important not to diagnose your problem at home by yourself, but come see a registered healthcare professional who could not only help you assess the problem and also help you find proper treatment for the issue you have been experiencing.